speaker is Mr. Rajan Sharma. He's the head training and development in Abbott Nutrition. Rajan is an accomplished L&D and OD professional with a keen interest in human behavior. He's a lifelong learner with 3 master's degrees under his belt. He's a certified OD and change professional. He's a gold medalist from TESS, where his project on values and workplace incivility got him Nirmala Devi Award for Best Project in Organization Development. With 14 years of enriching experience in learning and development, both in domestic and global roles, his areas of interest are around change, coaching, and culture.
It's really a pleasure being here today, and thank you so much for having me in this forum. I must congratulate the entire team of MEHR, especially Mr. Nitin, for conceptualizing such a wonderful idea and bringing the like-minded people, yet so diverse together in a forum like this from various industries. So good evening, everyone. Today, what I'm going to talk to you, colleagues, here is something about perspectives from pharma industry, and welcome to my world of pharma. Now, pharma is the 4th largest industry. So Indian pharma is the 4th largest industry in terms of volumes globally, after US, UK, and Japan. Interestingly, we employ around 4.5 million people directly or indirectly, and contribute around 4.5% to the country's GDP. What is also interesting is that the growth, if you see on the chart, the growth from today around 37 billion that we have done in 1920 would actually grow to over 125 billion in next 5 years. This is an industry which is there to stay. And I remember my chat with Nitin when he spoke and said something around pharma, that pharma is doing well. Yes, Nitin, pharma has done well even during the COVID times. But there are a lot of aspects around pharma which people might not be aware of, which have changed drastically and dramatically, and there has been disruption around a lot of factors, especially in the pharma. So my fellow colleagues here have already spoken around the leadership, how the leadership development has happened over the period of time, how the business processes have been laid during the COVID period. I today, in fact, would more talk not about the leadership and not about the business process and not about the managerial effectiveness. I want to focus my entire conversation, given the time that I have in hand, around the people on the ground. And these are the pharma sales representatives. So if you see, only in Abbott, an organization like us, we have around 14,000 people who are doing the ground role. All of us know these people as medical representatives. We call them sales reps. We call them PSRs and whatnot, right? So ultimately, it's all about the person who is on the ground, who is the face to the organization, in front of their customers, and they are the people who actually have multiple roles to play, starting from not just being the face of the people to the organization, they are also responsible for driving the organizational growth and revenue targets. In a typical day, a medical rep comes in contact with customers, primarily the HCPs, healthcare practitioners, doctor. So whom do they promote their features and benefits of the product, and use various tactics to get their recommendations. That's on the one hand. On the other hand, they also connect with patients to ensure compliance of the medication. I think that's an important role we in pharma play to ensure that what the medicines are supposed to deliver should actually get, the patient should get benefited out of it. More importantly, the reps in the field, they also circle back to the organization with customer, consumer, and the competitor insights. So, ladies and gentlemen, the COVID not only has changed things for all other industries, it has drastically impacted pharma as well. So, the changes that we have seen probably in a decade's time in pharma, we could see those changes in just last 6 months. And what we're going to talk today, especially about, is how the people on the ground who are supposed to be the people who earn the revenue for the organization, who are the face of the organization in front of their customer, how things have changed for them, and what as an industry or as a part of the industry we are doing to help people come back to the speed. So healthcare practitioners are the core customers, right? So here's an interesting survey, and I know Nitin has already shared some of these insights. Just to add on to what Nitin said, and specifically adding from the pharma perspective, I would want to share with you an interesting survey which is done by an organization called Ipsos. So Ipsos actually did a survey with various healthcare professionals to understand how would they like to interact with pharma companies, both pre-COVID, during the COVID, and the post-COVID time. Not just that, they also wanted to check what are the various ways that they would want to engage with this pharma company. So this is an interesting insight that we have here, which clearly reveal that there will be new channels that HCPs would want the people to connect with. It's no more the face-to-face. Yes, face-to-face, as some of my colleagues earlier said, face-to-face is going to be the important way of selling. However, the need of the hour and the post-COVID, what's going to be new normal, HCPs are looking at connecting through various other channels as well. And not just various other channels, they also expect the various medias to be coming. So rather than just a person coming and talking to them, they are now looking at various modes of information also coming from digital content to very customized patient needs which getting addressed, to interactive content which should be shared to them. So I think the needs from HCPs have changed. So that's the first paradigm or the first parameter I wanted to share with you. And what the second thing that I really wanted to share with you was another aspect. Now, when we went and met some of these HCPs and asked them, how do you expect the role of the frontline sales rep changing? And there's an interesting insight which clearly suggests that the role of the pharma rep is going to change dramatically. From 70% of the HCPs who says that people on the field would not be doing the same roles as they were doing earlier, to people saying we want the pharma reps to be more equipped in terms of knowledge dissemination. They should be better in terms of facilitating the patient-doctor interactions. So there's a paradigm shift from what people were doing and what been expected out of them. So if I have to summarize and draw parallels on the current and the future role of the pharma reps, right? So, and which is not true just for the pharma reps, it's true actually for any business which has direct customer contact. For all B2B businesses or B2C businesses, this would actually hold some kind of truth. So what do we see here? So from a very typical pharma selling, which was dependent upon just going and meeting the customer, which now the current role or the expected the future role is where we are expecting the pharma rep to deal with multiple things. We are expecting them to do not just be the jack of everything, but actually be an expert or doing multiple things. So what does this mean? What does this mean is that the pharma reps need to, the skills that have brought them here may not be the skills which will take them to the next level. Skills of today may not be relevant for tomorrow. So there is a need of shift. Shift not just in the mindset, but shift specifically from the knowledge and as well as from the skills perspective is also required. Now, what did this insights from the customers and from the industry helped us to do? So we went back to the drawing board as an L&D. We went back to the drawing board, and there were a lot of paradigms we wanted to discuss. So, starting from whether it is an engagement, which is a critical piece, or whether we start developing people, whether it is important to skill them on the current competencies, or which are those new competencies we want to skill them upon. Not to forget, we are dealing with people. All of these people are suffering from anxieties. The VUCA world is coming to play. So are we losing our focus that we're dealing with people, and we are completely focused on what do organizations expect? And finally, how much control in terms of learning and development we have, and how much autonomy we can offer to people. So I think these were some of the paradigms we looked into, and quickly move into another interesting aspect. And I think I'm a great fan of Jane Hart. Jane Hart is a name in workplace learning and development. And what Jane Hart has brought in here quickly, clearly says that from modern workplace learning standpoint, an organization has to have amalgamation of uh, the learning and development needs which are addressed around individual needs, which are addressed around the group needs, and also give opportunities to people to interact one-on-one, and therefore have social collaboration and have personal learning journey. So though the courses do not give a lot of autonomy to people, these are more pushed from the L&D people, may not have that much of value, but sometimes it becomes critical when it comes to new ways of working, etc. However, to increase the value of overall L&D courses and overall L&D offerings, I think it's important to slowly move the track from courses to resources to social learning, and to finally into the individual needs and therefore personal learning. So I know all of us are aware of some of these tools. So when I looked into what are we doing in terms of enabling from courses to resources to social to personalized learning, we realized that there are a lot of offerings which are available. And as Nitin said, some of these offerings are actually not expensive at all. Some of these offerings are free. Some of these offerings are available just on the click of a button. So looking into the kind of needs you have, people have some of these offerings. So people in L&D like me have some of these offerings to choose from, and therefore offer these to people to create that the learning eco-structure, the learning architecture, which enables people from not just shifting their mindset, but shifting their knowledge as well as skills. So I will now quickly in next 2 minutes show you 4 use cases on how we use some of these technologies and brought the learning to life. So this is the first thing, and I really want to talk about, and why this first is customized learning journeys or something, and it's an actual screenshot from how my sales rep and how my business manager looks into it. So we did elaborate, very exhaustive competency mapping, and out of that, what people get to know is where do I stand in terms of these competencies. And when it looks at competencies, they already have courses which are mapped to those. I, at my own will, I, at my own speed, can actually go to these courses and take assessments to check if I'm actually learning or not. These are also linked with their IDPs. And finally, there is a monthly one-on-one conversations which are happening between a manager and the reps on the field or the first-line managers, which is helping people to understand, am I moving to the right direction? So that's the first use case I really wanted to share with you. The second use case, I think Nitin also spoke about this, is very interesting one, how we can create the bite-sized learning. So Nitin, you spoke about 60 minutes of bite-sized learning. Here we actually deliver 5 minutes to 7 minutes of bite-sized learning. So starting from creating infographics to expert videos to small simulations to even the videos with 3D animated videos, etc., animations, etc., that we have created. And these videos are just 3 minutes to 5 to 7 minutes, where people get the learning almost on weekly basis. So, and all these are in line with the marketing and the organizational expectations. So this is another one. Finally, I know virtual reality is something which is still not taken the shape it as would be, but here's an example. The person sitting in the middle is actually one of my reps who is looking through the entire simulations, which is on a sales simulation, through a VR set. So in our endeavor to create and replicate the real life scenarios using the multisensory digital experiences, here are some of the snippets you would see that we have used in using or leveraging simulations, not just the plain simulations, but the 3D virtual reality simulation, where people can actually sit and feel that I'm sitting in front of my customer and talking to my customer, and he has to answer. Unless he answers, he cannot progress to the next step. So therefore, giving a very real life scenario experience to people. And I think that has worked very well for us. It gives people freedom to go and experiment. It gives freedom to people in terms of taking the learning at their own speed. And I think that's what is working well in current scenario. And finally, the last and the most important aspect, I would say, is the sales enablement of the learning apps. Now, in this time when people are not connected, in this time, and I heard one of my colleagues saying, or one of the speakers earlier saying, people are distributed across, they are in different places. How can we ensure that the same learning, the same messaging is getting spread across the organization? And something like sales enablement really works well. Where on a swipe you can send a leader's message to connect them with the latest in terms of what is the organizational announcements, to connect them to the marketing insights, to connect them to the various capability initiatives. I think here's an example of what we have used by using one of the apps, and actually incidentally from Hyderabad itself, on how we connected with the field force of as large as 1,000 just on a click of a button. We create a small knowledge asset, push it to people, people take those assessments, their colleagues, their peers review that and give feedback to them. And I think that's really working well for us. And finally, the last important point is somebody asked this question, and I completely believe in that. None of these interventions will make sense unless they are driven by data. So there has to be robust mechanism. And this is just an example on how robust the data can be, from overall organization on where you are in terms of capability to individual tracking, such as to keep 2 screenshots and put it there. Your L&D initiatives cannot be run standalone unless they are in line with the organizational priorities as well as they are data driven. So this is something which will really help. And if you're looking into driving some of the organization, and if you want to create a change in your organization, I think data driven interventions is the way to go. And finally, if I have to summarize, what did I learn in this COVID period? And I think these are the 4 learnings I would want people to leave away with. That learners are different. Everyone has different needs. So you have to have knowledge assets which address everyone. Second, capability is not the responsibility of learning team alone. There have to be multiple stakeholders. The role of business to role of HR to role of L&D is equally important in that. It's a systems thinking. Thinking of I will only work on sales team and will not do anything in the marketing, and the distribution team does not reach to reskill. I think we are living in the fool's world. One impact on one part of the body impacts everywhere. I think that's very important part. And how agile we can be. How quickly we can turn around and say, hey, this works and this doesn't. Let's stop this and bring something else which makes sense, which moves the needle, and which is impactful to the people in the organization. So thank you so much. I know